Sometimes the term delay is used to talk about young children whose developmental skills have not reached the level expected for their age. These developmental skills might include things like language, movement, problem solving, or play skills. As a child grows, they may or may not catch up in these skill areas. The term intellectual disability is used if a child continues to have much lower than expected thinking and self-help skills by the time they're 6 or 7. Usually this assessment is based on tests of thinking skills and their ability to do everyday tasks. What are the early signs of an intellectual disability? Usually, the more severe the intellectual disability, the sooner you may notice signs. Every child is different, but some signs that might suggest the need for follow-up with a healthcare provider include developing the ability to sit, crawl, or walk later than other children, learning to talk later than other children, or having trouble speaking, trouble remembering things, trouble understanding social rules, difficulty seeing that their actions might cause things to happen, which we call cause and effect, trouble solving problems. How is an intellectual disability diagnosed? Intellectual disability can be predicted in early childhood, but usually isn't diagnosed until after age 5. The diagnosis is usually based on a careful look at the results of cognitive tests, plus a range of tests that measure how a child functions in everyday activities. Consideration is given to the degree of developmental delay and the pattern of developmental growth up to that point. Consideration is also given to a child's environment and how they interact with others on a daily basis. What causes intellectual disability? There are many different possible causes of intellectual disability. It is sometimes associated with a genetic syndrome like Down syndrome or Fragile X syndrome. Intellectual disability can also sometimes develop following an illness which can affect the brain, such as meningitis, whooping cough, or measles. Other factors that may contribute include differences in the way the brain is formed during pregnancy, certain infections during pregnancy, and severe problems around the time of birth, such as not getting enough oxygen. Very often, however, we can't find a medical reason for the child's intellectual disability. Are there other conditions associated with intellectual disability? Some other conditions occur more frequently for people with intellectual disability. These include autism spectrum disorder, cerebral palsy, epilepsy, attention deficit hyperactivity disorder, as well as depression and anxiety disorders. Identifying and diagnosing these conditions can be hard. For example, it may be difficult to recognize depression in an individual who can't tell you how they are feeling. Family caregivers are very important in noticing when there are symptoms. An accurate diagnosis and proper treatment are important for an individual with intellectual disability to have a healthy and fulfilling life. Boston Children's Hospital is committed to keeping children and adolescents healthy. If you have any concerns about your child's development, don't wait. Speak with your primary care provider or visit bostonchildrens.org right away.